So 5 years ago, what happened?
Somebody was coming down some stairs. They landed right into me. We went back, I landed on my butt, and then fell back and hit my head.
Okay.
Maybe about a month later, I started cramping in my calves.
Okay.
My feet were curving in, like when I tried to walk. And then I started losing strength. I couldn't.
A month after that fall?
Yes.
Okay, and in
Slowly.
that month, between the time of the fall and the onset of the symptoms, the cramping in the leg, you had no symptoms, nothing else?
Nothing.
Any other traumas, accidents, slips, falls?
I cannot think of anything else.
Okay, where was this?
This was in my hometown, Ingleside, near Corpus Christi, in Texas.
Okay, got it. And so you started cramping, you started getting all these symptoms.
Yes, and then I couldn't just get up in my pickup truck. It was too hard. Then I couldn't squat and stand back up. The pain, I was going through pain as well, I guess because my muscles were deteriorating.
Okay.
It started to raise up. It got to my limb girdle, my girdle area.
Mm-hmm.
My back was in severe pain. My muscles were deteriorating in this area. I was walking like this, like a little old lady. Once it passed there, I was able to, the pain wasn't so bad, and I was able to stand up, but I have to stand with an arch, because if I stand normal, I'm gonna fall forward. I don't have the muscle no more, or the strength. Now,
If you hold on, let's rewind. If you arch your back, you're okay.
yes, I can stand.
You can stand.
Yes.
And if you don't arch your back, what happens?
I'm gonna fall forward.
You're gonna fall forward. Okay,
Yes.
I got it.
Yes.
Okay.
And since then, in between, about 6 months after, going through all that, I started to become constipated.
Okay.
My insides weren't working. It started to become really dry, almost black, and now it's gotten to the point to where I have to take something to go to the bathroom. I cannot go to the bathroom at all.
Okay. All right.
I have gotten more stomach issues since then. Recently, I've had another episode where I felt like it's moved up. My arms now hurt.
What's moved up?
The weakness.
Okay.
The weakness and the losing the more muscle.
Okay.
Now, my hands are very weak. My arms, I cannot lay on my side. I've got a lot of atrophy.
How much weight have you lost?
I've lost
in 5 years?
50 pounds.
50 pounds you've lost in 5 years?
Yes.
Okay, now who have you seen for this?
I have seen a neurologist. They sent me to muscular dystrophy specialist.
Okay.
The muscular dystrophy specialist to spit swab, blood work. They can't find anything. They're telling me that it's an unknown, late onset, unknown muscular dystrophy.
So the symptoms are presenting as MD.
Mm-hmm.
However, there's no definitive objective findings to say that it is.
None.
What are they looking for objectively to say that it is?
They did a muscle biopsy to see if there was anything in my muscles. Nothing showed up except for the person who read the muscle biopsy. He put in his own notes that he seems to think it was medication buildup in my body.
What medication were you on?
I was taking a lot of antidepressants and some
Okay.
other stuff that they had me on at the time. I'm no longer taking anything. I was dealing with depression.
Okay.
That stuff like that.
Okay.
And that's when I got sick, when I was on a bunch of the medicines.
Okay.
Yes.
All
Okay.
right.
So nobody ever looked into the medicine buildup.
Okay.
Nobody did anything about that. They didn't see what they were looking for, I guess, and just left it at that.
Okay.
And now it's starting to affect my heart. I've been having heart palpitations for the last year on and off, except for the last good 6 months I've been having them routinely.
Every day?
Almost every day.
Okay. Are you working right now?
No.
You're home now.
I am home. I have to use a cane to walk. I lose my balance real easy. If I bump into anything or anybody bumps me, I'm going down. My reflexes are off. I've noticed that I've got a slight slur now since I've noticed the upper.
More on the left side or the right side?
I think it's this side because my eyes, been noticed it's been like going to the this way.
Sit up straight, please. And what I'd like you to do is slowly open your mouth. And we can see it deviates to the right side, but that could also be a jaw misalignment we can check, okay? Go ahead and open it again. So it deviates to the right. Slowly close. Now, look all the way to the right. Look all the way to the left. All the way over. Follow my finger here, please. Good. Follow my finger, please. We have a little bit of nystagmus in the eyes. Were you getting dizzy from that just
Yeah.
now? Okay. So we have a little nystagmus in both eyes. Okay. What else?
That's about it that I can think of. I've been to the emergency room and hospital good 10 times in the last month and a half.
For what?
My heart goes out of control. They've got me on metoprolol to keep my heart under control. It's even though I'm on the medication, I can still be just sitting here and like all of a sudden it just goes out of control. Before it was it was an AFib all the time. They got the AFib under control, and now they said that the electrical in between the top and bottom wasn't firing correctly now.
Okay.
So now it's hard pounding, like I'm fixing to pass out. Like that's what I feel. That's
when you came, because you came in and
I can't
you
breathe.
You had to lie down.
I can't catch my breath. I feel like it's literally fixing to black out on me.
Mm-hmm.
Here recently, I've been feeling like I have to go to the bathroom by myself.
Okay.
When I go through that. I'm pretty sure there's lots more.
Well, we have somewhere to
I have
start.
a lot of atrophy. I know that. I can't squat, bend up. I can't stairs.
And what we were gonna do just now is just to see you stand with the cane
Mm-hmm.
and just see if we can take a couple of steps, and you can sit right back down just so we have a baseline.
Okay.
Okay? So why don't you do that, please?
And this is the way I have to get up. I can't
Okay.
just stand up.
Okay?
Okay.
And what about, so if we're walking, go ahead and, you got a little bit,
I
right?
used to walk better than this.
Okay? Turn around.
On my good days when I'm not going through this, I can walk a little faster.
Okay.
But
All right, have a seat. We don't need to do more than that. Why don't we then go ahead right into the exam, okay? And then from the exam, we'll figure out where we're gonna start, and then...
I'm sorry.
No, go on,
I
sorry.
don't have any back pain unless I'm standing too long. Then my lower back is just excruciating to where I can barely sit down. I have to slowly sit down.
Okay.
Because it's like an accordion, like it's bent, and then I have to slowly sit back down. That's about it.
Okay, I got it. I did take a look at the films, just to get a quick peek at what we're dealing with. Let's go ahead and examine you. Let's figure out where we're gonna start.
Okay.
We gotta make sure first the messages are coming down from the brain to the rest of the body. You had a bad fall. I don't know, did anyone check your upper cervicals? Did you go to a chiropractor? Were you
No, that's just
recommended?
it. I went to nothing but doctors, and finally
Well,
they're
here's
not
the,
helping me, so
here's
I'm
the good
here.
news. Here's the good news. Let's not look at it that way.
Okay.
Let's look that they ruled all the serious stuff out. There's no
Okay.
fracture, there's no hemorrhage, there's no tumor, right?
Yes, that's correct.
So they did their job,
Yes.
and that's fine. They did their job. Let's not go with that energy.
I've been thinking it's not their fault, that's what they're taught to just prescribe.
Well, let's not even go there. Let's just say you went through the protocol.
I went through the
all
protocol.
all the serious things have been ruled out. Now we need to check the nerve pressure.
Okay.
That's it. Okay.
Okay.
Let's go with that thought. What we need to see is there nerve pressure? And my dear, you have 25 points of nerve pressure off the chart. Actually, it's gone to 30. My meter reads to 25. You're at 30 on the left. And as it came down, but it's still kind of lingering and hanging on the left side, You have upper cervical cord pressure, and then it switches sides at the bottom. You have a classic cord pressure in her upper cervical, and it's even in the chapters, in the Gonstead chapters, where we talk about how to find Atlas cord pressure, what it presents like on the scope. So what's happening here? You're getting a lot of pressure on this left side in terms of the heat on the meter, and it goes all the way down like this to the sacrum, and then it switches sides. What does that tell us? Well, let's look at the upper cervical model, and you tell me what you think. Stick your fingers in there, 3 fingers, snug. That represents your spinal cord, okay? Your atlas, keep them snug, is like this. It's pressured there. What is that doing to the cord?
It's cutting it off.
Or it's pressing it, right?
Yes.
And that could be affecting it all the way down, because I'm getting it sticking all the way down to the left side, okay? So that's the first thing we need to evaluate. Head down, please, dear. Thank you. I mean,
It's tender
you
on
can
that
feel
side.
it. You don't even need to do
Yeah,
any
it's
more.
tender.
We don't need to do more than this. I mean, I can feel it protruding into my thumb right now. If I touch the right, that's fine,
Yeah.
correct?
Mm-hmm.
This is a left
Yeah.
atlas,
Yeah.
man. I mean, there's no point in even touching anything else right now. And the atlas has, you've heard of the vagus nerve?
Yes.
You familiar with the vagus nerve?
Not me.
Well, you need to understand it then, okay? So,
That's
if
what
we
I-
come over here to the chart, we can see we have, this is the autonomic nervous system. In the autonomic nervous system, we have 2 parts of it. We have the sympathetic nervous system, that's the fight or flight response. That's the speed everything up. That's the run, that's the breathe heavy. That's the, you see a snake or a bear, your body either gets ready to fight or run. The green, or the second part, is the parasympathetic nervous system. That's rest and digest. That's slow everything down. Well, we do have connections going where?
Yeah.
We do have
Everything.
connections going where?
Everything.
Okay? It actually has connections all the way down to the transverse colon, the stomach.
I just discovered the vagus nerve, and then I discovered you, and that's why I'm here.
So you started doing some research.
Yeah. Again, yes, I've been doing it since I got sick.
And you've been doing research, you started to discover neurologically there's a little nerve there called the vagus nerve, right?
Yeah.
And that vagus nerve has parasympathetic control all the way down, right? So then you started to do what? You were looking for someone.
I just was on YouTube, and you popped up.
Got it. Head down. Is that difficult?
No.
Does that hurt?
No.
Okay, it's stiff, but let's turn right. Let's turn left. Goes easier to the left, yes?
Yes.
Doesn't want to move as well on the right. This is divorce test.
Yeah.
Look up, turn left, but that's okay, right?
Yeah.
Tightness, but movement is there.
Yes.
Nothing sharp. This is a left atlas. And I'm just going to go to the x-ray to get a listing, and I'll be right back, okay? Confirmed it on the x-ray. We have a left atlas. However, I also have to check C2 because it looks like a critical atlas. Do you feel this?
Yes.
C2 is
Yes.
on the right, C1 is on the left. We have an ASLP atlas, but we have a PRS C2. And in that case, so what that means is your axis, C2 has gone to the right, atlas has gone to the left. That's the disconnect in the upper cervical. So what I'm gonna do right now, to start, we're gonna set C2 very lightly.
Okay.
C1 then, we'll probably just do it here as opposed to going over there, okay? And then we'll see what happens from there. C2 PRS. This one's gonna be light. Ooh, she's tight. There you go. Okay, yeah? You're okay?
Mm-hmm.
That already calmed a little bit of the left side.
Yeah, when I lay in bed, I can't even pick up my head.
Mhm. ASL Atlas. Home run. That was a home run, lady. Give that a second. That was a double clunk right to one good. Just look at me, please. Open your mouth. It's a little different.
Yeah.
Follow my finger. Come closer so you can see her eyes. I need to see her eyes. The nystagmus in your right eye is gone. The nystagmus is gone in your eyes right now. Less headache or same?
No, I don't feel all like.
All what?
All like this.
We got a little smile also. Good. Let's go back and check now. Head down. Turn left. You see the difference now?
Mm-hmm.
So we did a critical atlas on her. Wow. Went from 30, 25, 30 points. You are clear. And now as we run the meter, it's not sticking on the left side anymore. Sit up straight, please. It's a little bit on the right. Guess what, ma'am? 0 now, all the way.
Oh my gosh.
That's where we're gonna start with you. Now watch this. We're not done yet. I want you to see something. For the adjustment today, that's all we're gonna do. Critical atlas. You're gonna do lots of icing in the neck.
Okay.
At least 20 minutes of icing, 15, 20 minutes. Wait at least an hour and a half, do it again. But here's what I want us to see. Stand up with me now. Hold my hands. You're okay. Stand up. Tell Auntie what's different.
I was able to pull and use my legs.
Can you walk towards me?
Yeah, I can walk.
Walk this way, please. If it's uncomfortable, you stop. Turn around, please. Let's tuck the gown in. Let's have you walk towards the orange table. Turn around, please. Walk towards me. You're okay. Tell me what's going on.
I
Speak.
still feel a little unbalanced.
That's
Like I
okay.
gotta, with my feet, I've gotta grip them real good.
Yes, ma'am. How's the head feel?
The head feels fine.
Okay. Go ahead. Walk one more time back and forth. You see what's happening here, Auntie? Yes?
Oh, and I feel like I don't have to arch so much and hold myself.
Correct.
I can feel like.
It's going to be an interesting day today, okay? I don't know what's going to happen. I'm not going to tell you I do. All I know is we had to clear that upper cervical. We'll need to work on the low back. Walk one more time.
Let's see. I looked up and looked at her and smiled, and I got a slight off balance.
Okay. Stop there. Turn around. This way. Turn around. Keep turning. Palms up. Okay. Close your hands. Fist. Turn. Okay. Look at me. Raise your right leg. Raise your left leg. Raise both legs.
Let me sit down first.
Okay, raise the right leg. Look at me. Use the hands as you need it. Close your eyes. No, raise your
Oh,
leg.
I'm sorry.
This is a different test. Close your eyes. You can do it.
Okay.
Keep your eyes closed. Open your eyes. It's all good. Right leg down. Left leg up. It's a lot easier on that side.
Yes.
What you think, Auntie?
Good.
Not bad, huh?
Not bad at all.
Just had to crack the neck.
Yeah, and that's because I got a phone call from my
Let me see.
doctor. Your cervical and your thoracic X-rays come back perfect.
Well, yeah, there's no fractures. There's no...
Yeah, I guess that's what they're looking for.
Now let's try this. Stand up by yourself. Stand up. Come on.
Still got a cyst.
Come on.
I remember 5 years with no muscles.
Look at that. Have a seat again. And the next one, just humor me one more time. Stand up by yourself, please. Push off your knees, no problem.
Okay.
Yeah, use that. Absolutely.
It's a lot better than what it was.
It's a lot better than what it was.
Yes.
I'm happy with that. That's where we're going to start. Okay?
Okay.
We got work to do. You're here for
And
the
all
week.
that, and up and down, and I'm still okay.
Yeah.
Good.
And you weren't walking in here. We had to get the chair,
Yeah.
go downstairs, put her in the rolling chair and roll her up here.
Yeah.
Yep.
And then she was lying down for how long?
Oh, goodness.
About an hour.
Yeah.
Hour and a half.
Yeah.
That's usually when she has to stay down for an hour and a half or
If
two.
not longer, because it'll just keep happening, keep
Okay.
happening.
Last thing I want you to see, come over here, is when you were opening your mouth earlier, it was deviating to the side. Look at me and go ahead and open your mouth. There's less deviation now. Something else you can test out, you can test this out then, is you're standing, you can kind of time yourself and see how long you can stand before it starts to hurt.
Okay.
And I'd like to do that every day this week. Okay,
Okay.
so we have a baseline, we have some sort of thing to compare. Okay, my dear? Welcome to the office. That's where we're gonna start.
Thank you.
You're welcome.